Hello and welcome. I know I said I wasn't going to talk about the cancer journey really because this is a budget channel. However, a couple of you have said they would like to sort of hear the story and they're really interested in the journey, and that's fine. So I am going to talk about the cancer diagnosis and the journey. I hope this will help you if you've been diagnosed with cancer or you know someone who has, one of your loved ones perhaps, in terms of looking at what someone else's story is like, and so you can, I suppose it gives you a little bit of hope and gives you a little bit of a comparison to go by. So this is purely and simply me sharing my story so that you can just identify with that and think about your own experiences and compare. What I would say is I'm not medically trained with this, and this is very much my own experience. So please, if you are going through a cancer journey, make sure you always refer to your care team, and you're very aware that whatever I talk about in my video is about my personal journey, and it doesn't necessarily refer to you in your journey, because we're all different. So I thought I'd start by talking about when I got diagnosed. So I got diagnosed through a routine mammogram. I'm of the age where I get a mammogram every 3 years, and I'm very good with things like that, and I went along to the mammogram screening session, and I did get recalled. I actually missed an appointment, unfortunately, because I had been unwell and hadn't been at home to get the letter to recall me. So I got recalled to a second appointment, which was just days later. So I went along to that appointment expecting to be told I'd got a cyst, or they'd seen something and they just wanted to investigate it. But I got a very different response when I went there. I was very surprised at this. So when I got called into the room with the nurse, she sat me down and immediately she said, "We have found a lump and it is cancerous." And I was blown away by that, because I didn't expect them to be able to know categorically that just by seeing something on a mammogram meant that they knew it was cancer. I really thought that I'd need to have a biopsy, and then perhaps the next week I would find out whether it was or it wasn't. In a way, that's a good thing, isn't it? Because what that means is I wasn't left in this sort of void of not knowing whether or not I did have cancer. It was a shock. It was a massive shock, and I think I wandered around Newcastle, which is the major city near where I live. I think I wandered around there for a couple of hours, just not feeling in my own body. I did feel very dissociated for a while, because it's a massive shock, isn't it, to be told you've got cancer. They immediately took me in and did an ultrasound scan and a biopsy there and then. So I didn't have to wait for an appointment, which was brilliant. That was all done. And I was told that it was very tiny and that it was very treatable and it would be done simply and quickly. I was told I would need to have surgery, which I wasn't very happy about. I was very anxious about that. Having an anaesthetic is something I really feared. I've had it before. I don't know why I'm sort of fearful of it. Just am. And I was told I would need radiotherapy. I wasn't told I would need chemotherapy. I found out later that I would. Let's talk about that in a few minutes. So I went away from that, still obviously feeling very shocked, but kind of relieved, because they'd found this tumour. What they said was, if I hadn't have gone for the mammogram, it would have been a different story. If I had left it and we'd found it a year later by a breast examination, that would have been a different story. The lump that they found wasn't able to be felt by me or by any of the care team. So it was so small that it was only able to be detected on the mammogram. So at my callback appointment, when I got the results, I was told the type of cancer that I got, and I got a type of cancer that is known as HER2 positive which means it feeds off a particular protein. What that means for me in terms of treatment is that I do have to have, on top of the surgery and the radiotherapy, I do have to have chemotherapy, because there's a targeted treatment called Herceptin which has to be given alongside a chemotherapy drug. So that at this stage, when I got told that I had got that kind of cancer, that's obviously all in the pipeline. Nothing was written in stone with that. That was all to be discussed. So the next step for me was the surgery, and so that took place on the 21st of October, so just a month later. It was very quick, and I had a lot of prep to do before the surgery. I got things to clean in the house, and I wanted to make sure I'd got enough shopping in and all of that, and I've talked about what I've done with that on a different video. So I had to have somebody with me, so my daughter came and helped me with the post-surgery. So I went in as a day patient. I went in as a day case. I was admitted to the day unit and assessed, pre-assessment before that obviously, as you do, but again assessed, did all, you know, my observations and everything. My surgery wasn't until around 2 o'clock in the afternoon. I walked into the anaesthesia room, going, I'm kicking cancer's ass, this is round 1, and I lay down on the bed and cried. So I'm brave, I am brave, and I am kicking cancer's ass, but I'm scared, and I don't think anybody who has cancer will say there's a moment where they haven't been scared. I think we all are. Scared of lots of things, not just scared of having cancer, but scared of having surgery, scared of the risks of surgery, and all sorts of things. So in I went, and off I went to sleep, and came round a couple of hours later. I think the surgery takes about an hour. What I've had done, by the way, is not a mastectomy. I've had something called a lumpectomy. Okay, so they've just taken a little bit of the breast tissue away, where the lump was, and they take what's called margins. So they make sure that they take normal tissue that surrounded the lump, which gives you a safety margin, and what they do is they test those margins for cancerous cells, which tells them if you're clear in those margins when they do the biology on the tissue. If you are clear, that means that they've got everything, they've taken everything away. And they also took a couple of lymph nodes, and they tested those, because the first place the cancer will spread to is the lymph nodes. And so if the lymph nodes are clear, they're pretty certain that your tumour hasn't spread anywhere. So that's what they did, and I want to talk a little bit about the recovery journey for that. So I'm now 5 weeks post-surgery, 5 weeks today on the day I'm recording this, and I forget how, shall we say, I'm not going to say unwell, because it's not unwell, but I forget how much healing I've still got to do 5 weeks in. I actually thought I was 6 weeks in, and I looked at the calendar and thought, no, 5 weeks. The first day was, I was still a little bit in a daze, I think, from anaesthesia, but I came home, rested. All I wanted to eat was porridge and yogurt. I didn't want dinner. It was really strange, that, and I couldn't sleep that night. Day 2, I went for a walk, and they tell you to go for a walk. You must move, really, and you are sore, I will say, but it's not as bad as you might think. So you've been given what's called a nerve block normally. You have been given a lot of pain relief, which is really good. They tell you to take your pain relief and keep that up, and I did that for about 4 weeks. Not all of it, so I took paracetamol for 4 weeks, and I took codeine for about a week. So don't like taking tablets, so I'm trying to reduce that as much as I could. What you can expect following that kind of surgery is you will be tired. You will be tired. So all I could do for the first 3 to 4 weeks was get up, get ready, which, by the way, for the first 2 weeks for me meant I couldn't have a shower, couldn't wash my hair. Not everyone is like that. That happened to me because I'd lost a little bit of blood and they'd had to sort of reinforce my dressings, and those dressings that they reinforced with weren't waterproof, so I couldn't get those wet. So I just had to have like a wash rather than a shower, which was really challenging for me because I like my shower. Couldn't wash my hair, so one day I got so sick of my dirty hair that I went to the hairdressers up the road here and got it washed and dried. It didn't need to be cut, and it was lovely to have that done. I do the exercises that they've given me every day. So that if you've had lymph nodes removed, you do have to do exercises to make sure that your arm doesn't stiffen and you've got the full range of movement. So make sure if you do have this surgery that you do those every day. I did have to go back into hospital about 5-6 days afterwards. I didn't feel very well. My heart rate was really high and they did think I was having a bit of a panic attack at one time. But all in all, I think it was probably panic coupled with, you know, sort of trauma. Maybe you do get a bit of a trauma response when you've been given a diagnosis of cancer and you've had surgery. But also my hemoglobin count was low because I'd lost some blood. I'd actually got some extensive bruising, so I'd bruised all the way down my side, all into my tummy and all into my back. So I would look like I'd been trampled on by a horse, really. But I wasn't sore. You know, when I say this bruising, it wasn't bruising. It was it's kind of seepage from when they've done the surgery. I've not been able to lift things, so I've not been able to lift a full kettle. I've not been able to change my bed. I can't open heavy doors and things like that. I've still got to be really careful. I'm healed beautifully, so the scar is very neat and you can hardly see it, but inside I'm still healing. I've got a little bit of a bruise still and a little bit of it's kind of firm, like sort of underneath where they will have done the work. A little bit still, not as big as it was. It was massive and firm at one time, but it's come down a little bit. So I think, you know, if you are going through this journey, expect to feel sore, expect it to feel a bit hard, not hard, a bit firm. You know, but if you're worried about it, you just talk to the team that you've got. They've been amazing. The care team have been amazing. I've slept on my back, so I've not been able to sleep on either of my sides, because even if I sleep on my right side, which is not affected, I feel sort of a pull and a drag on the left side, and I just think, you know, it's not worth making it sore, really. So I've sleep propped up on my back. Again, not everyone has to do that. That's just the way I've felt comfortable. It was a challenge when I went to stay overnight somewhere else. My mum's, I normally sleep on a camp bed, sort of a floor camp bed, and I couldn't really sleep. It wasn't really a good idea, to be fair. I think just being patient is the thing. So just, you know, every day certainly the first 3 weeks, I needed an afternoon nap, and I needed just time, lots more time to get things done. So it's just about making sure that you remember that you are on a healing journey, and it takes time. It really does take time. What's coming next is, I have been informed I've got to have chemotherapy and this drug called Herceptin. So chemotherapy over 12 weeks, alongside the Herceptin. So I'll get chemotherapy every week for 12 weeks, and I'll get Herceptin once every 3 weeks. I've got no idea how I'm going to react to those medications. Some of the side effects can be a little bit daunting, I have to say, but I'm just very aware that I've got a care team around me, and I will be taken care of and looked after. And if my body doesn't agree with the therapy, I can stop that. I don't have to carry on with it if I don't need to. The reason I'm having chemotherapy is with this type of cancer, whilst the surgeons removed everything and there's nothing there in that breast that we need to worry about, with that type of cancer there is a chance that microscopic tiny little cells that we can't see under the microscope have escaped and gone into the bloodstream. And what Herceptin and the chemotherapy drug does is make sure that those little cells can't survive, so they get destroyed. And that's why we have to have chemotherapy. Even though I've got no tumour left, there may be some of those cells just flying around my body deciding to set up home somewhere, like my liver, my kidneys, anywhere, basically. So it's belt and braces, really. It is very much a preventative kind of treatment. I have every right to choose not to have it, but my chances of survival are greatly increased if I do have the treatment as opposed to if I don't. So I'm having it. I do face quite a challenging year, I think, because I have got 12 weeks of chemotherapy, and then I've got a further 9 months of Herceptin, and need to be monitored really closely for my health, because it can cause other health concerns. And I've also got to have radiotherapy after my 12 weeks of chemo. I will come on and talk about the chemotherapy experience and talk about the radiotherapy experience of Herceptin in other videos, but that's where we are for now. The impact it's had on me in terms of budget, because we are a budget channel, is massive. I have not been able to pay off any of those debts. I've not been thinking about the budget, I will be quite honest. I've just been having what I want when I want it. Life's too short. I know that sounds odd coming from, you know, the budget ninja, as I've been called. Life's too short to worry about things like that. So that's it for now. That's my cancer journey up to now. I will keep you updated. Please let me know if this is something that you're interested in. Please like, please share with somebody if you know that they are going through a similar journey. I'd love to think that I could help somebody who is on a similar journey to me. Please let me know in the comments if you've got anything that you'd like to comment on, and I will see you next time. Bye bye.